My name is Dr. Mumo, the Medical Superintendent, Mwingi Level 4 Hospital. I really wish to thank the Speaker and the team from the County Assembly for visiting the hospital and coming to see what we have been doing, and also to come in to support us in the proposed developments. I wish to state that at the hospital we are currently doing well. We have expanded the hospital to currently being a 220-bed capacity hospital inpatient, and also dealing with 400 to 500 patients outpatient. Most of these patients are usually satisfied with our services, and we thank the county government because this week we received a big supply of drugs and other medical supplies. I think we have many good ongoing projects in the hospital, like the outpatient department behind us. It's a good project which was done by the county government, and also the new surgical ward. Though there are few stalled projects which the Waheshimiwa have seen that we are proposing to be completed. The main among them is the Mother and Child Center, which will really occupy have a 100-bed capacity for women and children in a newborn unit. We would really urge the county government to really complete that ward and to have it functioning, because currently our occupancy in the medical ward is more than actually our capacity, and that stretches our capacity to hold the patients, leading to some sharing of beds, which is not good. The other thing we'd really request to be done is the equipping of our amenity ward, which was done during the first term of Governor Malombe. It was done very well, in more than 50 million spent in constructing the building, which is a story building. However, it has not been equipped to handle patients, and we just need to equip it with beds and other equipment required for the ward to work. If this can be done, it would really help, and it would help to increase the revenue collection for the hospital, also in addition to helping the patients, because the amenity ward has 24 patient rooms, which gives a lot of privacy for people who would want to have privacy, to target the civil servants, the teachers, and other people with insurances, which would also help us to improve services for the people who are needy, because we can use the revenue generated from the insurances to help the needy people in the other general wards who are unable to pay. Thank you.
Area MCA, also Chairman of Health and Sanitation Committee. I must start by thanking Daktari and Hospital Fraternity for the cordial welcome in the facility. Secondly, we have seen a lot of good work which is going here, especially helping our people with the services. Thirdly, we have also observed challenges which are in the hospital, especially the stored project, not forgetting to mention just a few, like mortuary, the amenity ward, and the child and mothers ward, which were left in the state they are by the former governor, whom we must say he did a good work in this hospital during his first term. For example, his building was broad and built up during his term, and he did a lot in this hospital, and also bringing KMTC. What I can promise this hospital, the chair now, is that we will liaise with the governor to jumpstart the stored project so that our people can be helped. There are some projects which are very touching, especially we have understood that we don't have blood bank here, and knowing this is an accident-prone area or hospital, we need blood bank. We also must thank our partners, like the partner which is bringing oxygen plant. So we will cooperate and help this institution. Also, allow me to request the medical fraternity to be up to task so that they can help our people. Thank you.
Kitui, we are here to conduct what we are calling the County Oversight Tours, where we are visiting various government projects in Kitui County. We actually, the 60 of us, the 60 MCAs, we have spread ourselves across the entire county. Since Monday to date, we are doing the County Oversight Tours, visiting government projects which are in our county to establish their status and to also find out whether the staff who are there are working appropriately, and also to establish the various issues and challenges in those facilities. Because as the government of Kitui, the assembly and the executive must work together. As a lawyer, I can tell you Article 176 of the Constitution is very clear that there shall be a county government comprising of the county executive and the county assembly. The county assembly plays a very crucial role in ensuring that the county executive implements the government agenda. And you see, our governor, who is we know is a performer, is ready to work for his people. And as the assembly, we have the duty to represent our people, because the duties of members of county assembly is to represent their people, to make laws, legislation, and to oversight. What we are doing here today is oversight. And I want people to differentiate oversight with opposition. What we are doing as the county assembly is oversight. But some people, for their own political interests, they like confusing the public that the assembly, when they are doing oversight, they are opposing the government. The answer is to the contrary. As the assembly of Kitui, we are determined to work with our governor, to partner together, to serve our people, because we all serve the same people. Here in Mwingi Central, for example, when the governor is implementing these projects in Mwingi Central, especially this hospital, he is serving the people of Mwingi Central Ward. And the same the MCA for Mwingi Central, Mheshimiwa Bernard Mwangangi Munyazia, aka Sila, is also serving the same people. So we should always, as the assembly and the executive, work together, partner, complement each other, so as to serve our people. I want to assure members of the public that contrary to what people are trying to say, the County Assembly of Kitui is united, is working together with the governor so as to ensure efficient service delivery to our people. And Daktari, be assured that as the County Assembly, we will support your work, because you are here representing the governor. Being the MedSoup and being the MOH for Mwingi Central, you have a big responsibility. And I believe the governor will support